Made her last visit, and the adult teeth are supposed to last the rest of your life. But we all know that may not be the end of the story. Many people lose adult teeth, and it can be tough to find a good replacement. Now, a lot of people are turning to dental implants as an alternative to bridges and dentures. Healthweek's Jim Slade reports on the promise and the pitfalls.
What's your response to the independent...
If he couldn't talk, Scott Smith couldn't work.
Did you sign an employment agreement with the company?
Yes. Smith is a Boston trial lawyer. His career was threatened by an inherited disorder that was destroying his teeth.
I had a couple of teeth that fractured, literally fractured at the gum line, which would mean I would end up with a crown in my hand, and inside the crown would be the tooth.
He knew he'd have to replace his teeth. The question was, with what?
I frankly didn't want to have to worry about dentures loosening in the process of making an oral argument to some appellate court.
See the difference?
So Smith went to Dr. Paul Schnittman, a pioneer in dental implants.
When he came in, he wasn't able to function. He actually was a dental cripple, and this was really a debilitating problem for him.
It took nearly 2 years for Dr. Schnittman to implant a full set of upper teeth and about a quarter of the teeth in Smith's lower jaw.
The process itself is not totally painless, but it was remarkable how little pain was involved in it.
Smith's dramatic case is the exception, not the rule. Most dental implants are done in people who are missing 1 or 2 teeth.
This simulates the bone and gum tissue.
There are 2 ways to install dental implants. The most common method is done in 2 surgical steps. First, a titanium anchor is screwed into the patient's jawbone, and the surrounding tissue is allowed to heal under a temporary bridge. About 6 months later, step 2 occurs. The gums are reopened, and the post that'll hold the artificial tooth is attached to its titanium anchor already in place. Dr. H.P. Weber of Harvard School of Dental Medicine prefers the newer one-step method that he helped create. In this procedure, the anchor is inserted into the jaw, and a post that'll hold the tooth is put on, all in one surgical step.
It's definitely saving the patient that additional surgery. It makes it easier for the dentist, and it shortens the overall treatment time.
While experts debate which method is more effective, they agree that dental implants are now a part of mainstream dentistry.
I think implants have become a predictable alternative, and very successful alternative, I say, in modern dentistry.
It's a wonderful procedure, state-of-the-art. However, there are some things to keep in mind. It's complicated, it's still expensive, and at this point, there is a 10 to 15% failure rate.